Hi, my name is Dr. Robert McCarthy, and I am a contributing author to this book, Energize Your Brain, Change Your Life. I want to welcome you to my website regarding peripheral neuropathy. If you're watching this website, this video, it's because you or someone you know and love has been plagued with peripheral neuropathy. And what exactly is that? Most people who are suffering with peripheral neuropathy will have very similar symptoms. It's pain, burning, numbness and tingling down the arms and into the hands or down the legs all the way into the feet. And this can be crippling and debilitating. And unfortunately, traditional healthcare does very little to help with the symptoms of peripheral neuropathy. That's why I've created this website here, to give you some more information and let you know that there's another way that you can handle this issue. We're going to tell you how you can finally end this chronic health nightmare that you've been dealing with. I'm going to tell you a couple of things that makes us different, what makes us different from any other doctor that you've seen before. First, I want to tell you that we leave no stone unturned in trying to determine the cause of your peripheral neuropathy. We treat patients very differently than any other doctor you've ever seen. We treat people neurologically and metabolically. Neurologically, we hope to achieve improving the way your nervous system functions, your brain and your peripheral nerves. The peripheral nerves are the nerves that come off your spinal cord and go into your arms or your legs. We do that by improving the fuel delivery to your nervous system, oxygen and glucose. And then neurologically, we're also going to work by activating your nervous system exactly where it needs to be activated. Metabolically speaking, we examine people from head to toe. We're not just interested in getting rid of your symptoms, we're more interested in energizing your brain and changing your life. And when we can fix the way the inside of your body works, metabolically and neurologically, you can get better. And quite often, this is the only way you can get better. Let's face it, if the medications worked, you wouldn't be sitting here watching this video. You're still suffering, you're taking medications, and they don't work. That's crazy. We have an alternative. Let me take a few minutes and I'll explain to you how we evaluate our patients. First, we do a complete metabolic workup, a thyroid panel, a complete metabolic profile. We do a lipid panel, a CBC with differential. We do some sensitivity testing as well. That's not being done anywhere else. There's very few people who understand this stuff, and I've learned it from some of the most brilliant minds in the country. If you've got a sensitivity to certain things and you continue to put these things inside your body, you're playing Russian roulette. And that's crazy. I'm here to help. Some other things that we do. We test adrenal gland function. We also look for autoimmune disorders. Very common. Autoimmune disorders can cause peripheral neuropathy. And what's happening is people are being treated with drugs like antidepressants, when in fact we should be fixing someone's immune system. It drives me crazy. This is why we're doing this video. Next, we'll look for the intestinal environment inside your body. One, we look for any pathogens, any bugs or infections that are living inside your intestines. This has a profound impact on your nervous system. Another thing we look for is what's called H. pylori, and this is also a very common infection that's overlooked. We test for it. There's only one way to find out if you have it, is to do the proper testing. Some other things we look for are neurotransmitters, the chemicals that your nervous system uses to communicate with itself. So the nerves send messages to your brain through neurotransmitters, and the neurotransmitters come from your brain and go out to all these peripheral nerves, hands and feet. Other things that we look for are inflammation inside your body. How do we know if you have inflammation? We've got to check for it. And in all these lab reports I get from other medical practices around town, it's not being tested for. We know how to do that. We also look for hormone panels. Lots of times there's hormonal changes. And if you've got hormonal changes that's negatively impacting your nervous system, You're never going to find that out unless it's properly tested. Some of the metabolic stuff that we do is just not being done, and that's why we can't get to the bottom of your peripheral neuropathy problems. How about the treatments? How are our treatments different from everywhere else that you've seen before? Some of the things that we do, like I said, we work on the fuel delivery to your nervous system and on activation of your immune system. Some of the ways that we improve fuel delivery is through dietary changes. Remember I said glucose. Your brain needs glucose. However, if you're eating the wrong foods, you can get too much or too little glucose. That's disaster for your brain and your nervous system. And if that's your problem, you're never going to get that fixed with a drug. You've got to fix your diet. We know how to do that, and I can help you do that. Another thing that we work on is oxygen. Your brain is the most oxygen-dependent part of your body. If you're not getting proper oxygen to your nervous system, again, disaster. We show you ways to improve oxygen delivery to your brain. And then activation. We use many different treatments that nobody else is using in order to activate the parts of your nervous system that are not functioning properly. Some of the things we use here in our office are vibration therapy. We use upper and lower extremity, arms and legs activation with exercise, upper body ergometers, lower body ergometers. Other things that we use are interactive metronomes, a metronome therapy, a timing therapy to activate a very specific part of your brain. Other things that we also do are auricular therapy, stimulating different parts of your ear. We use auditory therapy, stimulating different parts of your brain. We use smell therapy. Again, very powerful stimulation to your brain. And this is just not being done anywhere else. Now, what's the next step? What I want you to do is fill out the form right here on the website and request a DVD. On my DVD, I'm going to go into a whole lot more detail about what we've spoken about here today. And then you can understand a whole lot more about what's going on. But if this is you or a loved one who's dealing with this problem, I want you to sit down for a second and think about this. What has this cost you in terms of money, time, and relationships with others, your loved ones? And what have you tried in the past that just hasn't worked, like the medications I spoke about? What is it worth to you to get rid of this problem? And if you are serious about trying to get rid of this problem, you're in the right place. I want you to fill out the form, request my DVD, and we'll send that right off to you. I hope to see you soon. God bless you.